Good afternoon, everybody. My name is Fam Nkechi. Welcome back to my channel today. Yesterday was recognized all over the world as the World Alzheimer's Day. So I'm doing this video today to discuss about Alzheimer's disease, common symptoms that it presents with, and home care that such patients in the category needs for them to thrive. Alzheimer's disease is a progressive disease that starts usually with mild memory loss and then goes on to loss of ability to converse and do normal daily functions. This is the most common form of dementia. The part of the brain that is affected in Alzheimer's disease are the parts of the brain that controls memory, speech, language. This disease affects the person's ability to carry on normal daily activities. Usually there are 3 stages of Alzheimer's disease. The first stage is the early stage or the mild stage. The second stage is the middle stage or the moderate stage. Then third is the late phase or the severe stage. Common symptoms of Alzheimer's disease includes the following. 1 is memory loss. This usually happens at the beginning of the disease, and it affects the person's ability to carry on daily activities normally. Like the person gets lost in a very familiar environment. Maybe he wants to move from the room to the toilet. He sees himself at the balcony and he can't trace his steps back. Second is poor judgment. Third is when the person's misplacing things and finding it difficult to retrace their steps and to identify where those things are kept. Fourth is difficulty in carrying out familiar tasks such as the normal daily activities in the house, at home, or at work. They will find it very difficult to carry on these activities. Also is difficulty in handling money and paying bills. Late stages of Alzheimer's disease presents with the patient stopping eating and drinking. When this happens, it becomes very critical and the doctors have to get fully involved in their management. If these symptoms of Alzheimer's disease are left untreated, it goes a long way to affect the quality of life of the patient. But recognizing and treating these symptoms as they present goes a long way also in the other direction in improving the quality of life of the patient and the caregiver. And if these symptoms are treated on time, it can even help to reduce some of the cognitive symptoms of Alzheimer's disease, and this goes a long way, especially as you remember if that the disease itself doesn't have any particular cure. All you do is to manage patients and treat the symptoms so that the patient's quality of life will not degenerate so fast. So let's look at home care that we can provide for patients with Alzheimer's disease. The most important home care that we can provide is companionship. Usually these patients get very lonely, and when they are lonely they can throw into depression and they can have irritable moods and anger, and all sorts of outbursts can happen with them. So we need to provide companionship to help them to cope. Second is helping them to move around and providing support for them, mobility support. For instance, getting out of the bed and going back to the bed. And when they want to move around, we should make sure that they are assisted, because some of them can fall into the ditch or miss their step and they can have a domestic accident if they are left uncared for. Next care that we can provide for these patients is helping them with their daily activities like bathing, bathroom functions, toileting, grooming, even taking their medications. They need us to assist them to do all these things. And next also is helping them to fix and meet their doctor's appointments. Other aspects where Alzheimer's patients need care and support is in carrying out their normal home chores, like doing their dishes, washing, going for shopping, preparing their meals, providing support for them when they are depressed, and a lot of other activities that they should engage in to make them to live a normal life. So generally, for patients that's in this category, it's usually good to have a caregiver that will be engaged to help them to carry out all these activities so that the other members of the family can have their free time. So in conclusion, we've had a brief overview of what Alzheimer's disease is and the symptoms and home care for these patients. So in recognition of this day, 21st of September, which was yesterday, if you know anybody that has this disease, maybe you can make out time to give the person a call, find out if you can visit, it will be good, check on the person and help the person to cope better by whatever care you can afford to give. So I hope you find the value in this video. As usual, drop your comments if you find value in the video. If you have any questions that I have not touched that you want to know more, drop the comment also. And if you like the video, if it's of value to you, you can share and subscribe to my channel if you have not done so. See you next week.